Welcome back to a closer look. The need to treat cancer in the country is vital. With proper facilities and adequate equipment in place, that is the way forward. With the upcoming 57th Medical Symposium to be held in Papua New Guinea in the coming months, CEO of Port Moresby General Hospital, Dr. Paki Molumi, has given an insight on the need to address treatment of cancer in the country.
In a recent conference held at the School of Medical and Health Sciences in Port Moresby, saw the announcement of the upcoming 57th Medical Symposium to be staged at the Stanley Hotel in Port Moresby in September. The symposium's theme is Holistic Approach to Cancer in PNG. Every year, Papua New Guinea sees about 1,800 women die of cervical cancer from almost 400,000 cases detected. For breast cancer, 1,600 patients die every year from 4,000 diagnosed. With that, Chief Executive Officer of Port Moresby General Hospital, Dr. Paki Molumi, emphasized on the lack of cancer treatment facilities in Papua New Guinea. Firstly, Dr. Molumi stated that there is no cancer radiotherapy service.
Now, there's no cancer radiotherapy service, especially that component of the treatment of radiotherapy. Even the chemotherapy service as well. So we are not really up to the standard of providing good cancer care as far as chemotherapy is concerned. The medicines are very expensive and sometimes not available. That's why many of our Papua New Guineans who can afford are now going overseas to Singapore, to Philippines, and to Australia to seek cancer treatment.
With that, he explained the process of cancer treatment.
To ideally treat a cancer patient, you will first need to see a doctor with the problems that you have. Then the doctor will have to do some tests. They have to do X-rays, ultrasound scans, ask you a few questions. Then if they find out that, okay, you possibly have a cancer somewhere, then they will get a tissue of that wherever. Then you see a pathologist. The tissue undergoes histopathology, and they will be able to tell us what the cancer is. So the imaging will tell you how far this thing has spread through the image, and the histopathology will tell you what it is. So once you know what it is and how far it has extended in your body, then you plan the treatment accordingly. And also once you know the type of cancer, you can say you do surgery, we do chemotherapy, or we can do both, or radiotherapy. So in Port Moresby, you have the specialist here. You can provide a radiology service, and the only histopathology service for cancer diagnosis in Port Moresby. So to speak, the diagnosis of cancer and possibly treatment of surgery was done in Port Moresby. And we have the radiotherapy service provided in Ley, so through the Cobalt machine. So this service has not been provided for the last 3 or 4 or 5 years because the Cobalt machine is non-functional.
Moreover, another factor lacking in the space of cancer treatment, especially for the treatment of breast cancer, is that there is no early diagnostic program.
Even in that as well, we don't have an early diagnostic program. For example, for breast cancer, which you need to screen using a mammogram, or cervical cancer screening programs. Those programs are not well coordinated properly in the country. Because if you want to provide very good cancer service that you want to get a good outcome, which is cure, you need to diagnose them early. There's no point in treating when patients already present them late. So all of these things have to be provided in a more holistic way.
The challenge identified in the urge to fight cancer is that the country is lacking human resources or cancer specialists.
Human resource is one. We can build infrastructures and we can have all this, but human resource. As far for cancer, we don't have cancer doctors, radiation therapists. and the oncologists in the country. So we've recruited 2 oncologists. We've developed a curriculum which has been passed by the University Council. So once this facility is up, we're going to start training our own doctors using those experts who's going to come in at least for 4 years so that we can train our own Papua New Guineans to become cancer specialists, so that we can beef up the numbers and we can build another facility in Momase or in the islands region. Currently, it's not good to talk about building facilities everywhere when you don't have the human resource who's going to run, run those facilities.
Furthermore, Port Moresby General Hospital is providing the cancer service in a more holistic approach, where Dr. Malumi emphasized on this.
We are building 3 cancer bunkers, 2 of which will have the latest linear accelerator. We're trying to move away from the old-fashioned cobalt to linear accelerators, which are the latest form of cancer radiotherapy treatments. And we'll have a brachytherapy unit for treating cervical cancer, a chemotherapy unit. We are also improving the lab so that we can do diagnostic. And we've just installed a mammogram, and we are doing the cervical cancer screening program so that we provide the cancer service in a holistic way so that it's one-stop shop. In that way, we don't need to allow our patients to move around, but all services are provided at the same facility. And we want to stop many of our Papua New Guineans who are going overseas, raising exuberant amount of money to go and seek treatment in Singapore, in Philippines, or in Australia, because our kina is going out of the country. So we provide those services in the country. We keep our kina in the country. Not only that, but this facility is supported by international atomic agencies and many of the international organizations, so that the PMGH facility will be a facility for the entire Pacific Islands outside of New Zealand and Australia, so we can drive medical tourism.
The fight for cancer is crucial, in which both government and non-government organizations are taking the approach to educate and provide awareness on healthy lifestyles people can make in order to combat cancer. With the upcoming medical symposium, all health experts across the world are expected to attend and discuss more holistic approaches to address cancer in Papua New Guinea.
We take a break here and return on the other side with more.